afternoon. I'm Nada Husseini. I'm a vascular neurologist at Wake Forest Baptist in Winston-Salem. And I'm going to ask you, even though it's the afternoon and hopefully you'll not fall asleep, to close your eyes for a second. And no, really, close your eyes and imagine having unlimited time off. And now you can open your eyes. How does that make you feel? So this is happening in our institution. We have a new pilot policy that took effect starting January 2017 of self-managed time off, pretty much meaning you can take as much time off as you want. And what I try to do here is to survey physicians and faculty and see what they think about this policy. So why is time off policy important in healthcare institutions? As you may know, more than 50% of US physicians are affected by burnout. On average, a physician works more than 10 hours than other hardworking professional, more than 10 hours per week. And so maintaining work-life balance is not always easy. There are greater expectations regarding productivity, increased workload, and reduced physician autonomy, and lots of regulations that can lead to burnout. Burnout is well studied and shows that it can lead to worse patient care and outcomes, and also high turnaround time for faculty in any institution. So that really makes it important for the viability of healthcare institutions that a healthcare institution would look into the well-being of faculty they have. So Wake Forest came up with a flexible policy for time off. So that means that it's unlimited vacation for faculty and administrative leaders starting January 2017. And again, it's a pilot for 1 year. The purpose of the policy is to support a positive culture of personal responsibility, increase trust and work-life balance, and placing more value in productivity and quality of work rather than the hours worked. So how does it work? Is really unlimited time off means unlimited? Can you not work for the entire year and get paid? Obviously not. So you have to still do your job, and you have to accommodate for work commitments. Vacation hours will continue to be reported and tracked within each department, so somebody is monitoring how much time off you're taking. You have to get approval to take a time off by your chair, and you have to at least give at least 6 weeks notice, and in some departments more like 8 weeks notice. And what also it means that you no longer accrue vacation hours or maintain vacation balances. So the institution is not bound to reimburse any physician for time off that they did not take. So again, the objectives of this study was to evaluate the perception of the faculty of the self-managed vacation and its effect on their well-being. I did not survey administrative leaders, so this is for faculty. Explore potential barriers that faculty may be facing when trying to apply the policy. So in real life, how does it translate? And explore what other institutional efforts faculty would like to see to decrease burnout and increase their satisfaction in the workplace. So we used the survey. I used the SurveyMonkey to administer the survey. It was sent I asked 5 departments to participate. The Department of Surgery kindly declined, saying that they are participating in similar surveys, so they did not want to duplicate. So internal medicine participated. There were 288 targeted, 47 in neurology, 31 in pathology, and 36 in family medicine. The survey is made of 12 questions. 11 were multiple choice, 1 was open-ended, and it ran between May 25 and June 30, so right in the middle of that pilot year. So 402 were surveyed. I got the answer by 191. So that's a pretty good response rate of around 47.5%. A little bit more than 50% were female, about 48 were male, and most of the participants were between 36 to 45 years old. Most were in internal medicine, followed by neurology, and then family medicine and pathology. Most were assistant professor, but about 20% were associate professor, and close to 20% were professor. And here's, so how much vacation have you taken since January 2007? Again, remember, this is right around the middle of the year of this pilot. Most had taken 1 to 2 weeks, some less than 1 week. None were close to 3%, and then some had taken 3 weeks. None had taken 5 to 6 weeks or more. How much vacation do you expect to take between January and December, so for the year of the pilot? Most of the answers were 3 to 4 weeks, so that's really similar to what we were given on the more traditional model. And some had 5 to 6 weeks. More than 6 weeks was by some, and some answered none, which was close to 3%. So how does the length of vacation you will take this year compare to previous years? Again, a majority answered about the same, 75%. And how do you feel regarding this new approach to vacation time? So most of the participants were pretty satisfied. 46% were very satisfied, 13% were satisfied with some modifications, some were neutral, and about 6% were dissatisfied, and 7% were very dissatisfied. The majority agreed that the new approach to vacation scheduling supported a positive culture of personal responsibility and positive culture of trust. Also, there was a large agreement that it improved work-life balance, decreased physician burnout, and about 52 thought that this increased actually productivity at work. So now what hurdles, if any, are interfering with the current implementation in this, for the situation of any provider? And really what was the most intriguing here is the need to give notice several weeks in advance and the pressure to meet RVU target, as well as the multiple layers of calls. So these were the 3 higher reasons for actually implementing this policy. There was an open, here adding comments to what would you do or what else do you have to say about this policy, and these were some of the comments that were noted. I favor the old way to create more equity in the workplace. Currently, they had 2-month notice for a day off. While I have not used more than I would normally would, having the option to use it when needed makes me feel less stressed. I would love to take additional vacation, but feel it would affect my potential for raises. I am in the final years of my career and need to maximize putting money for retirement. No requirements for the institution to reimburse physicians if they don't take vacation. When we are working already too long hours, mostly due to epic demands, thinking of how to work even longer hours when I'm not there does not make sense. Not really applicable to hospital medicine, who actually take already week on, week off. And currently RVU policy prohibits vacation. And then go back to the old system. With the new system, I will work all the time. So what other changes would the physicians want to see to alleviate physician burnout? And interesting but not really surprising, the most answers were more support for administrative burden and more electronic health record support. Some still wanted an on-site gym exclusively for faculty physicians, creating an exclusive lounge for faculty physicians, daycare for child sick days, but only about 10% or even 9% really wanted more seminars about burnout and self-care. So the majority wanted something to really affect the time that they are spending. in charting and an administrative burden. Other faculty suggested initiatives were better parking, physician cafeteria area, decreased cafeteria cost, better call rooms, stop having meetings after 5 p.m., competitive compensation, a quiet room at each location dedicated to prayer, mindfulness, and meditation only. Some wanted a defined paternity leave. Some wanted a defined maternity leave. Protected time during business hours to answer phone calls and patient messages. And more support in clinics so that physicians do MD work, not RN or CNA work. So in conclusion, the majority of faculty were satisfied with the new vacation model, despite the majority reporting that the length of their vacation was going to be similar compared to before. Most considered the new vacation model as a positive change in the work culture. Some faculty felt more protected, however, under the more traditional model of limited time off, especially those who may not be meeting very easily their RVU target. Now they are even under more pressure to work and maybe feel more, cannot even ask for time off. Several prefer to have at least minimum mandatory time off. So additional measures are likely needed when you have such a policy to ensure equity and effectiveness of the new policy. And this is what I suggest based on the survey result. Potentially having a mandatory time off, in addition to having the option of choosing additional time off. Value rather than productivity-based model of faculty compensation, and a shorter notice requirement to request a vacation. So if you're gonna have to plan 6 weeks in advance to take a day off when you're really tired, it's pretty hard. And perhaps that can be linked to other models and of curbsiding burnout. For example, at Stanford, a few years ago, they did a pilot of banked timing or time in the bank, which meant that if you did more administrative work or you volunteered for certain things or you jumped in to cover at a short notice for a colleague, actually you would get rewards for house cleaning, home delivery, for meals, other real things that would save you time in the future. So perhaps having a model where you can take vacation at a shorter notice without feeling that you're gonna have a colleague have to cover for you and you're gonna lead to their burnout, maybe linking it to other policies that would actually reward others for doing that job and ensuring equity. And also the other conclusion about the perception about burnout is that while lectures about resiliency and mindfulness are really important and maybe helpful, what's really driving the burnout is not perhaps the lack of resiliency, but the actual lack of time. So providing administrative and electronic medical support and are additional important interventions to consider. So these are my references, and I want to thank Erin and Tina for your support and guidance with this.